Hi, everybody. Welcome to Beyond Telehealth. This is the second interview of Telemedicine is Medicine, and I am proud to introduce my big brother, Larry Finkelstein, who is a family medicine physician. And we are going to attempt to keep this at 5 minutes. So we call it 5 minutes with the Finks. So, Larry, introduce yourself. Tell us who you are, what specialty you practice, and where you practice.
All right. So real quick, first of all, maybe big brother, but we're actually Irish twins. So we're 1 month out of the year. We're the same age. So I'm Larry Finkelstein, DO, family medicine and geriatrics boarded. And I work in an academic clinical environment where we see patients, but we are also teaching medical students.
Okay. And where do you practice? What area, what town do you practice?
So we're considered an urban practice. We're in Philadelphia. Our medical students have an urban rotation, so that's what it's called, urban family medicine. So we are in urban Philadelphia, and that's where
Okay.
we are.
Were you using telemedicine prior to the pandemic?
We were not.
Okay. And now that it's a public health emergency, are you using telemedicine?
So at the onset of the shutdown of the country, we started telemedicine and have been using it since. So we have been using it since the month of March, and we are continuing to use it.
Can you tell us what platforms you started with, what you're using now, and what your EHR is?
So I and we played around with it for a little bit. There's um, free versions you pay for, platforms. I've been started out with Doximity Dialer. At first, getting used to it, you're probably mostly audio, and then work your way into video or real time, face to face. So actually now I go back and forth between Doximity and Doxy.me. They're
Mm-hmm.
both platforms, and the reason why I do switch back and forth is really patient dependent. Some patients may find it easier to use one or the other, or one connection may be better one or the other, but it's very quick to switch if I have to. The
So,
Also real quick, the EHR that we've been using, well, for the last 10 years, our EHR has been NextGen.
and you haven't gone through using video visits with your EHR at this point.
No, we're not. We haven't we haven't incorporated the telemedicine aspect of our current EHR.
Okay. So, in regards to challenges of using telemedicine, we've talked a lot about this. And one of the challenges that you mentioned is scheduling patients and, getting your front desk. Can you tell us just a little bit about those challenges of scheduling a patient?
So it just so happens that yesterday I had a telemedicine session, and frankly, it was a little frustrating. I only had 6 patients, but 2 of them were actual no-shows. There's no reason you should have a no-show during a telemedicine. They should be home. One didn't even answer the phone, and the other also was not there. So right there, patients normally need to be confirmed. Well, that confirmation also needs to be a little bit more an explanation of this is telemedicine, that it is still a visit. And then the challenge, so that's the main challenge. You really need the staff to have a cue sheet of what to say. It has to be across the board, and it has to be very similar to every patient, letting them know that it's an actual visit, that they need to have good Wi-Fi. And to be honest and frankly, the staff should be adept at connecting to the patients themselves, so they know that the system works before I fumble around for 5 or 10 minutes to see if they're going to be connecting or not.
Yeah, so these are very real challenges that doctors, face every day, whether it is real time or telemedicine. Telemedicine is medicine, so it's the same process that patients have to understand.
Right.
Let me just ask you about. We're at 5 minutes, so but I want to ask you about the medical students and teaching medical students using telemedicine, because that's something that I think is really important. So tell me how you incorporate medical students in a virtual house call.
So, ideally, the way we normally would have students is they would see the patients first, get history and whatnot, come and present to us, and then we would go in together to see the patient. In telemedicine, ideally, if the student had access to the EHR themselves, they would be able to also see the records and get to know the patient ahead of time, and maybe even perform a history with me there. What we're doing now, however, is that we're bringing the student in on the visit. And right now, they're somewhat of a shadow and they're observing. However, they can ask the patient questions after hearing us and incorporate them in the visit. So far, the patients have been more than willing and agreeable because they're seeing me and they're seeing the student both on there with them. And so the student is also privy to their home surroundings and looking in there also. So, it's working out well. And to be honest, we have a Georgia campus, and we have my students who have been with me on telemedicine have been coming from Georgia. So you can teach remotely. It doesn't have to be just the students right around you. So really, you can reach far.
Well, and I think this is the future, teaching remotely medical students and residents. So this is a great example. So let's leave the last minute, since we're over. Tell me a funny story that you have of a patient using telemedicine.
Well, so there's several funny stories. They all kind of go around to where the patient is at. And one yesterday, just yesterday, my patient who was a little bit late picking up, and he finally did. And where was he? He's in his car. And I'm like, "Are you in your car?" He said, "Yeah, but I'm parked." You parked? Because if you're driving, I can't do this meeting. So that's the one thing. Then he proceeds to grab a cigarette and start smoking. And I said, "Are you really smoking in front of your doctor?" And he's like, uh, and he threw it out. But I mean, and that's the second time that I've had a patient actually smoke a cigarette in front of me. What patient smokes in front of your doctor,
Right.
especially in your office?
All right.
And
And what patient drives when they're seeing, or in their car?
well, driving, we're not supposed to, you can't be doing a visit with driving, but a patient, whether they're at their home or sitting in their car and they're actually smoking a cigarette, or they're in their bathroom because they got good reception. So it's just a matter of where they are and hanging out. So
yeah, it's the new abnormal, right, Lar?
It's the new abnormal normal, right? Yeah.
All right. Well, of course, we've exceeded our time by 3 minutes, but thank you, Lar, for doing this. I really appreciate it, and we'll see. We'll do this again next week with. I think we're going to have an ER physician on for the next interview.
All right. Thanks, Leah. That was great. Okay.
Bye.
Bye bye. You got it.